CDC reports more than 8,000 people were hospitalized with COVID-19 across the U.S. at the end of July. That is the biggest spike in hospitalizations this year and up 12% from the week before. Okay, but here locally, UofL Health says it has seen a jump in positive testing for COVID-19 go from 2% to 5 to 7%. Dr. Mark Burns from UofL Health is joining us to talk about these numbers. Thank you so much for being with us this afternoon. So we want to talk about those numbers. Is that a significant amount of people, when it seems like the symptoms are less severe than they were at the beginning, and is it more like a common cold nowadays?
Okay. Well, to answer the first part of that, the numbers are somewhat significant. However, we've had increases over the last 3 years. The good part is that we're starting from a lower total number, and overall, the number that has increased is higher than what it's been the past several months, but overall still low. As far as symptoms and variants and things like that, with each variant, as I'm sure you remember, it seems as though, although it may be a little more contagious, it's not nearly as severe. The symptoms are still what they are. However, the overall number is a little bit lower than what it has been in the past.
All right, so a little bit of good news there today. And as of today, UofL Health says there are 7 patients with COVID-19 across all UofL Health hospitals and 1 in the ICU. So just as a reminder to people, what do you say people should do if they think they might have COVID-19?
Well, of course, the first thing you need to do is to be tested. The good part on that is home tests are available and they're somewhat invaluable. But you have to be careful about false negative testing. So in other words, if you have the symptoms and you test negative, it's always best to wait at least 48 hours and retest, because it is possible you could be in what we call the window period. That is the period where you're infected, but not enough virus is available to be detected on the test.
All right, some good reminders for us. Dr. Burns, thank you so much for being with us.
Thanks for having me.